啲官員入嚟。
Let's invite the administration team to join us.
啲官員入嚟，9個、2、4、6、7個，2、4、6、7，啱啱夠人。我請啲官員入場，係唔該。
Please invite the administration team to join us. Welcome to government officials and also Dr. Lo Chi Kwong for attending our first item on the Community Care Fund. The CCF will report to us the progress and the situation of the fund on an annual basis. So after listening to Dr. Law, members are welcome to give their views. So after Dr. Law has been seated, so please walk us through the paper. Well, Chairman, concerning the paper that we have submitted, let me briefly introduce it, and then I'll invite Dr. Law to speak. Well, since June this year, when we reported the work of the CCF to this subcommittee, once again, we are here to report to you the latest position, and we are here to listen to members' views. Well, since its establishment, the CCF has launched some 27 assistance programs under different areas benefiting different target groups, and as at the end of November this year, more than 850,000 person times have benefited, and a commitment of some $4 billion has been made. And in enclosure 2, we have set out all the details of the latest developments since June this year up till now with regard to the 5 more assistance programs offered by the fund. And also in November, we have also extended one program, and that's the special care subsidy for the severely disabled. And last week, with regard to the elderly dental assistance program, it was also approved that it should be extended to those who are on the old age living allowance. And there are already 10 items that have been made recurrent, and that would involve recurrent expenditure of about $800 million. And we've been listening to views from all quarters on the development of the fund, and we will continue to host further consultation sessions in order to listen to the views of the community. And we will also be organizing more focus group meetings in order to listen to the to gauge the views of the community and stakeholders on the work of the CCF. And I'll pause here and defer to Dr. Law. Yes, as Ms. Fu said, we'll be happy to listen to views from all quarters, and we will continue to listen to the focus groups' views and also the stakeholders. And during the past few months, we have received some comments, and as a result, at the last meeting, members also talked about this, and therefore, with regard to the pilot program on the special assistance to the carers for the elderly, and also we have also been offering the hostel subsidy for needy undergraduate students, and that's underway, and also for the have-nots. In other words, those who are not eligible for CSSA and who has no housing and so on, and the program will end by the end of August this year, and some 25,000 eligible tenants would benefit, and next year we're going to relaunch this program, and we expect that about 53,000 households will be benefiting. With regard to the elderly dental assistance program, well, initially it only benefits those who are on old age living allowance or OALA, And with regard to the number of dentists under the program, that's limited. That's why we are concerned that the dentists might be overloaded, and therefore we propose to launch it in phases, and therefore starting from the second half of this year, we would be working for those over 80, and then we'll try to lower the age threshold gradually from 80 to 75 and 70 and so on and so forth, and several hundred people will be available for the scheme, and with the assistance of the dental association and also some community groups, we hope that in the second half of 2015 we'll be able to roll out the program as scheduled. So we'll be happy to take members' comments and questions. Yes, I have Mr. Lee Cheuk-yen and another member, and I would give every member 4 minutes, and if there is more time, then I'll give more rounds. First, Dr. Fernando Zhang. First, Mr. Tenka Peel. Thank you, Chairman. I can see that you have a 6-page document. You have confirmed to us that, well, as you said in your report, there are some 27 assistance programs and 10 have already been made regular. In other words, you do have a target, and we can see that you're already implementing that. From the perspective of poverty alleviation, you would try to test run the program, and then once you find that effective, you would try to make it permanent and regular. And one of the biggest problems is housing, and for those who are needy households on the waiting list, well, they might have marginally exceeded the eligibility threshold, but then they are still living in poverty, and I can see that you do recognize that problem. For example, in Para 7, you said that out of the 5 programs underway, in fact 3 are related to housing, providing hostel subsidy for needy undergraduate students, and also the subsidy for CSSA recipients living in rented private housing, and also the one-off living subsidy for low-income households not living in public housing and not receiving CSSA program. In other words, the assistance for the and have not. So when are you going to offer assistance to needy households living in private housing? All right, they might be living in sandwich class housing. So what would you be offering rent assistance to them? So would that be done, and when would that be done? And when are you going to do a scientific study so that you can come up with a report, and then the administration will understand that, because you do have this regularization policy, so that any policy or program that has been proven effective will be made permanent or regular. And then as far as care for the elderly is concerned, yes, you have already made or taken a step forward. You have recognized the need of the carers. That's why you are offering this living allowance for carers of the elderly persons from low-income families. But then, as stated in your report, how come this will be offset with the OALA, and therefore, up until the last 6 months or so, well, if you look at the figures, the only 375 people got the benefit, and some $3 million was spent. So when compared to the $125 million that you have reserved or scheduled for that purpose, that's a far cry. So is it within your expectation, or do you think that is within your expectation, and the number that has applied is also within your expectation?
Let me explain on the first question. For instance, the hostel allowance. Now, this is to do with education and also to do with residence. Now, hostel provision is very important in university education. Now, for some low-income families, the children have to give up the experience of living in hostels because they don't have the money. So we hope that they would be afforded the same opportunity. Now, for CSSA living in private housing, now the rental subsidy in CSSA is not available to some people because they exceeded the income limit. So we tried this for 2 years. This is the 3rd year. The government will continue to review this scheme. Now, for the project regarding and have-nots, it's not a rental allowance. The scheme is based on the fact that in the past few years, the government has some poverty alleviation measures, and these are non-public rental housing residents, so they didn't benefit from them. I'm sorry. So will you not study and propose to the government a rental subsidy? Now, I've answered this question many times. This is a policy conflict issue. We haven't discussed this. We're not going to discuss this now. Now, for the subsidy schemes for carers, now at first the acceptance rate might be low, but we will continue to review that. Lee Chuk-yan. Now, Chairman, we keep saying that we should regularize the items in CCF. Now, let's now talk about a transitional arrangement. Now, the LIFA, Low-Income Working Family Allowance, that's a transitional arrangement. Now, we may have to wait till 2016. Now, we look at the poverty line. Now, the situation of poverty among children is most important. It's most serious. Now, the low-income children, that is, children in low-income families, is a poverty issue that needs to be resolved urgently. And the most appropriate measure is, of course, the LIFA, Low-Income Working Family Allowance. Now, we hope that they can be handled as they wait in the queue, but you will take a long time to complete the preparation work. Now, can you offer a subsidy to the low-income working families in the meantime, like in the case of the and have-nots? Can the CCF supply this transitional subsidy in the next year or two? Secondly, now on the subsidy for carers, now we have said many times it's unreasonable that the carers of the disabled do not get a subsidy. Now we've raised this many times when the scheme for elderly carers was proposed, and the number is only 370 odd. Have you reviewed why so few carers applied for this allowance to care for the elderly? Now, you budgeted a large amount, so there is some problem in the system. Have you reviewed that? Dr. Law? Now, for LIFA matter, we will study that. There's a technical issue. Now, when the CCF engages in regularizing transitional programs, as Mr. Lee referred to, now the whole system is new, so we don't have the personnel involved or the people involved. So we have to find these people to help them, and so there is no 100% matching. Now, we help them now, but in the future, they might not be assisted under LIFA. So there has to be some matching. And also, the funds have not been passed in LegCo. Maybe there might be a reduction somewhere because the item has not passed through LegCo. So is there some difficulty in the degree of care that we can provide? We will study the issue. Certainly we hope that the LegCo members will endorse LIFA quickly, and so that most of the people and then they can receive some kind of assistance under existing programs. Now, on extending the carer subsidy scheme to the carers for the disabled, now we've discussed this many times when we discussed the scheme for the elderly carers. Now, as you know, the district service network, we require help in the management. Now, and we also need criteria to identify the disabled. Now, for the those who are seriously disabled, they are more they correspond more closely to what we have to those what we are trying to help. Now, so we need support to take forward such a scheme. Ms. Lee, on the subsidy scheme for elderly people who are low income. Now, this is a scheme with 3 phases. Now, the third phase is not yet completed. We have received over 2,000 applications, and we've been doing the assessment, and there are over 800 cases who qualify, carers who qualify. The figure that we gave earlier was only up to November, end of November. So very soon, I think we will reach the target of 2,000. Dr. Fernando Cheung, Chairman. Now, of course, Mr. Lee Cheuk-yan mentioned the 2 transitional arrangements. Now, it takes quite a while. Even if we endorse LIFA tomorrow, it will still be a year or 2 away. So I hope you will quicken up the pace. Now, I don't think that there will be a big mismatch between the recipients compared with the recipients of LIFA. Now, it's very important that people get help as living costs rise. And the carers for the elderly, the subsidy, now even the target of 2,000 is very low. But please undertake a review. Do not limit do not set a limit regarding the care that they get at the day centers. Now, you try to provide care at the day centers, at home, and at the community. So try not to offset one against the other. Now, you've regularized this arrangement. 7,000 odd people are queuing up for this the scheme, and they only serve only 1,000 odd people. And now there's a very long queue for psychiatric services for children. Now, the queue is now, almost 100 years. Now, perhaps you should have this fund to provide assistance, psychiatric doctors should provide service to them for these children who are disabled. Now you should maybe provide money for them to visit private psychiatrists. And now some members are putting up their own money, and this is limited amount compared to the resources of the CCF. And the minorities say that they receive very little help, and the use rate is very low. Now it's about public examinations and language assistance, and so many young people of the minorities are unable to benefit from this service. Perhaps you can help them elsewhere. And it's not just with language, maybe with employment too. Perhaps you can provide a subsidy so that they can have greater opportunity to learn a skill. VTC wants them to form classes on their own with a minimum class size of 20, so they cannot jump out of the poverty. Dr. Leung? Please do not misunderstand. The subsidy for the carers of the elderly will not detract from the care at home that the elderly people receive at home. Now, whether they have carers or not, the amount of care service received at home depends on factors such as there are family members caring for them and so on. So please revise your document, because that's not mentioned. Well, it's mentioned in past papers, or there also is revealed in the details. Now, on the queue for the fund for the care for the that takes care of psychiatric services for the for children. Now we will go back and study this. Now there are a lot of SEN needs, and the assessment criteria can be complicated. We will go back and study that. On minorities, we know that the two projects receive few applications because one reason is that the minorities don't have time to attend the classes because they may be taking 2 or 2.5 jobs, and so they have difficulty attending the classes. Now, in the past, there is a group under the Commission on Poverty which has dealt with and discussed this issue. And they have been talking to the ERB and the Employees Retraining Board, and they are trying to help them through concentrated classes. And they will cooperate with Home Affairs Department so that there are more opportunities for for the minorities to receive aid to help them get jobs in the future. As to how to help others get jobs, now there are special projects at the ERB for them. Of course, there are financial concerns when it comes to having more classes. Please, members, please allow some time for Dr. Law to reply. Otherwise, we won't have enough time. Chen Yunhan, Ko Wai Keung, Ho Ka Ki, Tam Yu Chung, Ho Chi Ki. Chen Yunhan, I have 2 questions. I hope that Dr. Law can consider them. Whether you agree or not, there is filibustering in LegCo. Now, there are new policies, for instance, LIFA, low-income working family allowance, and many people ask us when we will get them. We can't tell them.
Even if you process the applications and give the approvals right away, that will take some time before it can be implemented. All right, you are doing the test runs with the CCF, but then is it time for you to deal with these pressing problems? So should Dr. Law or government officials be answering this question? Because these are hard-pressed people. They are in urgent need of help, but then because of some previous problems, this problem has not been dealt with. So what is to be done about it? Well, let me answer the question raised by Mr. Lee Chuk Yen first. We will see what transitional arrangements can be put in place because, well, for LIFA, after it's rolled out, it will take at least 15 months before anything can be done about it. So during this window period, we'll see what we can do to help them. In fact, this is already underway, but then we are waiting for some details to be made available before we can have a discussion at the CCF and make a recommendation on it. Yes, Ms. Fu, yes, we'll assist the CCF and members of the CCF to follow up on this comment. Yes, I still have some time left. Let me ask another question. I understand that, well, for some existing services for the severely disabled, theoretically, the administration has a policy on it. So for children who are have dyslexia and also ADHD, all right, in the fully subsidized or subvented schools, that's available, but then in the direct subsidy schools, it's not available. And I've visited some of these schools, and teachers told us that there was no direct assistance for them. And if they managed to enroll one or two such students, then the teacher would have a very difficult time. Yes, the policy is available, but then the policy is not able to cover all the schools concerned. So what is going to be done about it? The two of you. Yes, Chairman. So for those SENs, well, the allowance will be helping the mainstream schools. But then for DSS, this is the first time that I've heard it. So I'll go back to find out what the policy is and then see how we can help them. Well, they do have an association. That's the DSS association. So I can give you the contact. So you'll be able to find out because you're actually torturing the students with dyslexia. So you do have to help them. All right, you still have time. Yes, I have further questions. So how much time do I have? 4 minutes in total. I'm also of the view. First of all, I recognize the efforts made by the CCF. All right, you have the new money. All right, some $1.8 billion. Initially, the administration tried to work through the seed money so that there is this matching fund scheme. But then I don't know what difficulties you've encountered. Now you have the $1.8 billion available. So when will you be able to go back to the original idea, that is to mobilize the business sector so that it would also be prepared to help out? Because, well, the entire community has a lot of views about the business and also in particular the property development sector. So what are you going to do in order to get more funding from that for the $1.8 billion that's been accepted? And members have also approved recently for another injection by the administration into the CCF, and we are making good use of the money in funding the projects. That's why we are here to listen to your views. Well, that's not what I was interested in, because initially you tried to enlist the help from the business sector, but now it's almost like the administration is funding the scheme all by itself. But then given the wide gap between the rich and the poor, so I don't know how this can be done and under which policy area. But then how are you going to encourage them to donate more? Well, in fact, at the establishment of the fund, we've been answering questions on that. In fact, in the design of the scheme, it's not a matching fund scheme. And of course, we would like the business sector to be involved as far as possible. But then after some time, we believe that other than mobilizing the business sector to help, other than funding, it can also help in other directions. That's why if you look at the work of the fund, we try to enlist the help of the business sector as far as possible. And a few months ago, in fact, during the last LegCo session, there was this new injection for the matching fund scheme, and we call that a partnership fund. and we try to encourage a tripartite involvement. The administration will be funding the scheme, and then NGOs will be working together with the business sector in rolling out some of these programs. And for such efforts, they will continue, but then that might not necessarily have to be done through the donation of the CCF, but then poverty alleviation is one of the highlights of the work. Next, Tam Yu Chung, I'd like to ask this. For the disabled, when they go out, they might need to be escorted, and they do have this $2 fare scheme, and then the carers would also be entitled to that. But then what about the escorts? They might not be eligible for this traveling subsidy, and the traveling expenses could be rather substantial. So some suggested that is it possible for these carers of the disabled elderly, whether they are escorts or carers, would they also be entitled or eligible for this $2 fare scheme? So will you consider that? Yes, Dr. Law. Chairman, we have also received such comments. That is for escorts or people assisting the disabled elderly in taking public transport. Well, we do not have a specific scheme on that yet, because if we were to do it, then it would also result in a situation whereby we would need to consider whether or not it should be made permanent and regular. So we will have to see whether this can be launched as a pilot scheme. So for the time being, we do not have such a plan in place. Still, I hope that you can consider it. And of course, there are people who say that there are some technical difficulties that will have to be overcome. For example, for escorts who escort them to and from the clinic and hospital, the traveling expenses could be rather substantial. So can you consider offering some help to these escorts? Thank you. Yes, we will consider that. Mr. Albert Ho. Thank you, Chairman. My question is related to healthcare. Well, for medication, i.e. for cancer drugs that has to be self-financed, all right, that has increased from 6 to 9, and you said that it would be turned a permanent program. So from 6 to 9, is that right? So I don't quite understand what's the follow-up action. So what do you mean by making it a regular program? Well, for regularizing it, well, that part it's not about the individual drugs. Let me try and explain that. Well, by making it permanent, well, the Samaritan Fund used to have this threshold, that's the 30%. That's by way of co-payment. So either party will have to pay a share. And now that's been lowered to 20%, and after some time, it's found out that the financial and also the arrangements are feasible. Well, with regard to the medication or the drugs, well, it's different from the regularization of the program itself, all right, for the drugs under the Samaritan Fund or the CCF. In selecting the drugs, medically, the doctors are already prescribing those drugs. But then with regard to the scientific evidence, it might not have been sufficient to make it eligible under the Samaritan Fund or the standard formulary. So if the scientific evidence is not sufficient, and therefore the CCF is trying to do it first, and for such drugs the utilization rate is usually rather high, and therefore we believe that in the foreseeable future, where there is sufficient medical and scientific evidence to prove the effectiveness or the efficacy of the drug, so by making it permanent or regular, we have to select the drugs, and some of them will be included in the drug formulary, and some will be included under the list of the Samaritan Fund. It depends on the type of the drug and also the patients who are suitable to be prescribed such drugs. So it's not a policy decision. In fact, it's medical based. So from the lowering from 30% to 20% is already a policy decision, and it's been done. So for the 9 drugs, they have to be selected on the basis of scientific basis. So how often would that be reviewed? Because there are many voices saying that the scope is too narrow. It's only confined to 9 drugs. Well, I suspect that it would be reviewed at least once a year. But then in terms of the operation, that should be more frequent. And secondly, well, in public hospitals, when you have to undergo surgery, well, however major an operation that might be, you will have to fund part of the cost, for example, for the stent and also the instruments you used in heart surgery. You will have to fund it. And for the needy families, if they have to borrow the money, that would be quite hard for them. So can the CCF look into how you can help them? And also, yesterday at the Health Services Panel meeting, we also said that, well, you might be talking about colorectal cancer, and you're talking about a rapid stool test or culture test. So even if it's found positive, if you want to go a bit further by conducting this colonoscopy test, it would cost you $7,000-8,000 if you go to a private non-profit making institution. But then if you do it at a hospital, then it would take 6 to 9 months before your turn is up. So for the testing in the public sector, the queue is too long. And then for cancer cases, it's life-threatening. And if you delay the treatment, that could be life-threatening. So for this, it's one-off. Well, yesterday I asked this question, and they said that if the culture test is found to be positive, and if you do it again, then there is a 20-30% chance that you have contracted the cancer. Well, very often, for the consumables, for the medical consumables in medical procedures, and you will have to finance it yourself. And at present, under the Samaritan Fund, these people can seek help. And then by turning it a regular program, well, for the 30% threshold, it will be lowered to 20%, and it would apply to drugs and medical consumables under the Samaritan Fund. As you will have to queue up, whether you're just doing the laboratory test or whatever. Well, as far as the Samaritan Fund is concerned, the difficulty is, well, it's not just about the colorectal cancer that we just referred to. It's about the different kinds of conditions. And just yesterday, the administration announced the voluntary health insurance scheme, and if you take out health insurance, then that would be covered by your insurance policy. So we're talking about a major policy. So at public hospitals, many patients who are waiting for a diagnostic test to be done, well, the waiting time might be a bit too long, and that's about the overriding healthcare policy. I think that's more than what the CCF can do to help. Well, for the membership of the CCF, so they are all appointed by the administration. So I'd like to know how many members have been members of the CCF since its establishment. So is the administration still enforcing the 6-year rule? So are any members due for the term of 6 years? And also, when I scan the list, there are people from the welfare sector, and there are school principals, and also business sector. So most of them are professionals. But then with the years of experience that has been accumulated, so there are targets of the CCF. They have benefited from the CCF program. So have you considered appointing some of these beneficiaries of the CCF, because they have already benefited from the scheme in the first place, and they can also respond to the scheme, and then from the perspective they would also be able to give you their feedback. So have you considered that?
Now, concerning the CCF task force membership, now quite a few members have all along been on work related to CCF, because there was steering committee at the time of the Commission on Poverty, and there were a number of subcommittees on which these people sat. So we are still following the 6-year term arrangement. There is a 6-year limit. Now, on the second part of your question, now the best way to get the opinions of the beneficiaries and the family members is through focus groups. Now, whenever an item involves some beneficiaries, we try to get more understanding of the problems involved through these groups, and that's more helpful. Now, for this list, how many people are already close to being on the force for 6 years? Now, the steering committee and the subcommittees, they comprise a large number of members. Now, a lot of them are now no longer on this task force, but those remaining are not yet close to the 6-year limit. Now, well, actually, it's just a change in name now. So I hope because when we look at the list, we see that these are professionals with middle-class background mainly. Now, if you do not target your service clientele, maybe you can include some members of grassroots organizations. And, well, it's difficult to pick the right organization because there are many of them. If they invite us to go and talk to them, we will be glad to talk to. I think that would be more effective than selecting one or two, because it's very difficult for those who are below the poverty line, 970,000 of them. There are many organizations, so it's difficult to choose. Now, for community groups, some of them they're known as poverty alleviation committees, and I believe there are 3 or 4 of them. Perhaps the 3 or 4 of these can recommend 1 or 2 persons to sit on your task force. So I hope that you can plug this hole. So 3 members have given the names, but they are not here. So any supplementary questions? Chen Yuhan, Dr. Fernando Cheung. Now, on the drug cost issue, now the drug formulary doesn't provide drugs that are life-saving and people have to pay out of pocket. Now, the CCF has regularized some medicine for cancer, but still so we hope the hospital authority can make structural changes when they review the drugs to see which should be included in the drug formulary, which should be raised from 2nd-tier to 1st-tier drugs. Now, this process is quick in many countries, but not in Hong Kong. So the patients are disappointed, and the hospital staff and the doctors, and they have a hard time explaining to patients, now, this drug is a good one, but you have to pay out of pocket. And then they have to go through Samaritan Fund and then the fund takes into account the income of the whole family. So the whole family is dragged into it, and the quality of life of the entire family has to fall as a result. The younger brother may have to give up studying abroad, and one member might have to get married later. This shouldn't happen in a civilized society. The hospital authority is very inflexible, but the CCF has more affordability at its disposal. So you can review the structure of assistance for drugs. You should assist the voluntary groups and the family members of the patients, or the organizations representing them. You can get their views by a long-term mechanism, and you should then introduce a subsidy scheme and take the lead. The hospital authority is just too big. There are too many interests involved, whereas the CCF is more flexible. Now, we are talking about saving lives. We are not distributing cash to whoever wants it. Now, we are saying that even poor people get sick. You should be more lenient and include more drugs. For instance, the government-paid drugs don't extend to colon cancer. Now they have a very strange criteria. The cancer has to spread to certain parts of the body. Only 6% of cases receive approval for subsidy. So what do you do with the other 90-odd%? Now this involves medical knowledge. Now what conditions qualify for this for these government-paid drugs? Now, we are not all doctors on the CCF. Now, we depend on the this scientific committee to make the decisions. Of course, we are more flexible, but to establish the scientific database on these drugs, we need to set up a different structure, and we have to get a whole group of specialists to provide opinion to CCF, but that's duplicating the work of others. This is not our thinking behind the CCF. We try to make use of existing government systems so that we don't have to employ new staff or set up new structures. Now, for the conditions raised by Dr. Cheung, professional opinion is involved in many cases. Now, I certainly cannot answer which drugs should be provided for colon cancer. Now, there are already 2 drugs for which the government pays that treat colon cancer. Now, I'm not asking for a technical or scientific study. I want them to adopt a user-based approach, a more open approach than that of the hospital authority, because the CCF has the money and the drugs save lives. Ultimately, it's up to the doctor to make the decision on which drugs are suitable. I'm not asking you to supersede the work of HA. So please pass the views of Dr. Cheung to HA. Second round, Tanka Peel first. Two comments. Firstly, in the third item in your appendix, those who care for the elderly at their homes, the subsidy is provided. Now, the elderly care bodies feel that we don't have to use the CCF to regularize these items. Now, for some elderly who live alone, or they suffer a very mild form of impairment, there should be greater quantity of service or subsidy. Now, this is to be extended. This will end. The scheme will end on 31st of December. So, can similar schemes be extended or regularized? Now, so people do have such aspirations. Please look into it. Now, also, some elderly groups, as I've mentioned, to Dr. Law, now there are some Alzheimer's disease or similar diseases. The elderly have to wait for 24 months before they receive a diagnosis or assessment, but that doesn't mean they will then get the subsidies for those who are moderately handicapped. So can there be better service to make the assessment so that they are on a separate queue for non-drug treatment, so that there is slower deterioration? So on these two questions, please respond. Dr. Law? Now, on the first question, this scheme that is soon to end, the subsidy for those who clean the homes of the elderly or accompany them to medical consultations. Now, actually, apart from this service for which they queue, there are other ways for which their needs are met, and we have. After discussing with the service groups and studying with the Social Welfare Department, we feel that there is no need to regularize this item. Now, when the pilot period ends, it will come to an end. Now, on the psychiatric treatment for the elderly, this is a long-term challenge with respect to service for the elderly. And we are studying whether through the CCF we can provide support to the elderly who live in the community, whether we can assist them and their family. This is a matter that we are studying. So can you give us a timetable? I'm unable to tell you a timeline, but we hope to come up with that soon. Now, will you do it on a territorial basis, or you will find that through the local public hospital cluster? Now, we will study that, and we will give you an account. Albert Ho? I don't know whether you have studied this. Now, there are those who are applying for refugee status, who are staying in Hong Kong, and who are making claims of torture. Now, these people live in abject poverty, and the government provide nothing but the amount necessary for food and minimum minimal amount for transport. So this is inhumane and in the level of living standard. So can the CCF do something? Right now, the food provided is is of very low quality, and the food is obtained only once a week.
And there is no traveling expenses allowance. So they are not allowed to work even if they've been staying here for 1 or 2 years, and we're talking about some 1,000 people here, and they're living in abject poverty, and this is quite a disgrace to Hong Kong. So can the CCF plug this hole by offering some humanitarian aid? Yes, we can look into it to see if there is anything that we can do to help. But then my impression is that under the CCF, when it was first established, we also received suggestion with regard to asylum seekers' needs, but then we did not manage to come up with specific areas where the CCF would be able to work under the existing system to help them. But then we'll go back and take a look. So if you're able to offer them with some form of living subsidy, that would help. Well, they do not have enough money to pay for their rents, and some people have to work as illegal workers, and they would be prosecuted. So there might be something that the Security Bureau will have to think about it. Should they be denied the opportunity to work? So I hope that the CCF can be more flexible and think about it, because we are talking about thousands of people stranded here, and Hong Kong should not have allowed that to happen, because this is most inhuman. Ms. Chen Yunhan, well, for the issue mentioned by Dr. Fernando Jiang, I understand that. But then if you look at the items of assistance, well, for patients who are not yet covered by the Samaritan Fund, they are already taken care of under your scheme. I'm not going to talk about the loan scheme, because I've also contracted cancer before, and that's why I know some patients who are suffering from cancer, and every time for a bone cancer patient, it would cost him or her some $50,000 to have an injection for chemotherapy and so on. So under the CCF, should the administration consider this with an aging population? I think this is a worldwide trend. With air pollution, people might be contracting strange forms of disease. That's why when we face these problems, and if we have to go to the public healthcare system, there would be many problems. And of course, for the $50,000 per injection cost, well, that's an individual case. And I've also got this personal experience. That's aspirin. Well, because of my problem, I've been taking aspirin, and it was prescribed by a private doctor, and I did not have to take stomach drugs. And then once I was also prescribed aspirin by a public healthcare doctor, and then after a week or so, I started to have stomachache, because I was told by someone that well, for the previous aspirin that you took, that's a prescription from the private sector, that's why it's better. And then for the breast cancer drug that I took, it was better because I took it, or I got it from the private sector. So if the CCF is already working on some of these projects, I think you would also have to think out of the box. So if you're able to help people, and if it's about extending their life, then should you have adopted a more flexible approach? Well, for people who are needy, they are actually suffering a lot more if they are also sick. So can you think along those lines? Yes, we'll think about it. All right, he has noted your comment, and he would go back and think about it. All right, any further comments on the CCF? Yes, Dr. K.K. Kwok. Sorry, Chairman, I was late. Well, overall speaking, I cannot accept that the CCF be made a regular program, because if the administration thinks that these are needy services, or services that should be provided, then the administration should have made it permanent or regular. But then the administration is sitting on some $20 billion, and it will not be taking that away, and therefore they will have to embark on these projects. So I'm concerned about some details. For example, for the financial assistance for needy students, and also for the hostel subsidy for needy undergraduate students. So for needy students, they would be provided with hostels, but then if they are not able to get into the hostel, because when we were at the university, there were students whose families might not be able to afford to allow them to go into hostels, and as a result, they will have to live in subdivided flats, or they might be sharing bunker beds with other students. So at present, they would not be eligible for any subsidy at all because they are not going into university hostels. So if you really want to help them, can you also cover these students who are actually renting subdivided flats or bunker beds? And also for the $2,000 additional grant, this is really very small an amount. So would that really help? Why are you offering this petty assistance to them? Well, for the priority for students going into hostels, and also there is a scoring system and so on, and then for students with financial needs, and also for those who need to get a hostel place. Alright, they have a policy so that for every undergraduate student during their 3-year campus life, they will have at least 1 year staying in the hostel. That's also one of the that's also part of the education policy. And then for the situation that you just referred to, alright, they think they have a need, but then when compared to their fellow students, they have a lower priority, and as a result, they have to go into subdivided flats. That's a more complicated issue, so I'll have to go back and think about it to see if there is any room for the CCF to help. And then please do not misunderstand it. For the $2,000 grant, well, that is not just confined to $2,000, but then for the students not eligible for student financing, well, the administration is now reviewing the policy, but then in the process, we believe that for the 5,000 plus grant is not adequate. That's why the CCF is offering them an additional $2,000 on top of the $5,000. And then for the textbook related expenses, that could be as high as $10,000–$20,000. So we are reviewing the system, and that will be done later. But then, before the administration or the Education Bureau has completed its review, we believe that there is a gap between the existing assistance level and also the need of the students. We are offering this additional $2,000. We hope to ease some of the needs of the students with regard to the school textbook assistance scheme. And we believe that $2,000 is indeed inadequate. That's why the administration is now reviewing this to see how that can be improved. You really have to think about it. For the first point that I raised, or for some needy students, they are under that category. Alright, they would be eligible for 1 year stay in hostels during their 3-year university education life. But then some of them are living in very cramped places. So the administration is not short of money. So for these needy students, they will only be eligible if they meet the eligibility criteria. And also for the dental scheme, I'm also concerned about this because in the past, for the administrative cost that has been spent on this is somewhat higher than what has been spent on the elderly people. So how are you able to reduce that? I dare not say that it will not happen at all, but then can you reduce that at least? Well, on this latter point, well, last time when we introduced this dental assistance program, there were 2 bottlenecks. One is the number of dentists under the scheme, and number 2, for the home helper team, they do not have enough staff to escort the elderly or the elders to go to see a dentist, because under the current home helper team, the vacancy rate is more than 10%. So there are 2 bottlenecks under the program. That's why what we expect to do and what we actually are able to do is not exactly the same. And since the expenditure has been fixed, that's why the ratio has gone up. And on this occasion, we hope to offer that to those on OALA. Alright, the net would be wider. and all these elders are able to move around by themselves. That's why one of the bottlenecks will no longer be there. But then for the second bottleneck, that's about the dentists available under the program, that's still a problem. But then we hope that with the first bottleneck removed, we hope that more elders can benefit under the scheme. With regard to the overall administrative cost, that would be within control. Any further questions from members? If not, then thank you very much, Dr. Law and government officials, Ms. Fu and Mr. Leung, and Ms. Lee and Mr. Leung for coming for this item. Next is about the poverty situation. We have the Bureau Director with us. By way of a reminder, we have to hand over the room to another meeting by 4:30. There is no way that we can extend the meeting, so please grasp the time better during the next session. Well, the administration just announced the 2013 poverty situation, and the Bureau Director is the chairman of the Commission on Poverty, so he is here to brief us on the latest poverty situation. Welcome, Bureau Director and his team. So we have Ms. Lee and Ms. Ng with him today. Okay, you can start as soon as you're ready, Bureau Director. Chairman, members, good afternoon. So I'll briefly touch on the 2013 poverty situation. As you can see, we have a PowerPoint presentation, so I'll be succinct so that members will have more time to discuss the issue with us. Well, to recap on what happened in the past by way of the background, well, that's what the administration has been attaching a lot of importance to, the issue of poverty alleviation. Well, on the 1st of October, shortly after I assumed office, I already relaunched the Commission on Poverty, and we also reinstated the low-income working family we relaunched the traveling expense allowance and also the OALA. Many elders have benefited, and we have also injected $15 billion into the CCF. And by the middle of this year, a number of measures have been put in place. And in September last year, we also held the first summit on poverty alleviation, and we announced the first poverty line, and that signified the strategy on poverty alleviation. There has been a substantial change because we have this working tool, and that's very important to enable us to formulate policies to target those in need. And then on the 15th of January this year, the Chief Executive also announced this blueprint on poverty alleviation that helps us to deal with the poverty situation in the future. And our concept is very clear. Our philosophy is very clear. We'd like to encourage those who are able to become self-reliant to remain in active employment, and then we would also have to offer social security on the basis of a reasonable and sustainable basis, so we would be able to target those in need, and that would also help ensure the sustainability of the system. And then with regard to the blueprint, there are several points that we'd like to highlight. First of all, on the strategy, so we support employment, and we are also trying to take care of the children. That's why the LIFA is to encourage people to remain in active employment, and we would also like to encourage upward social mobility in order to break this problem of intergenerational poverty. And we are also awaiting for the approval by the FC on LIFA, and we would also like to improve CSSA, and also would like to enhance the children's in these needy families' ability to move upward as in our society, and we would try to regularize 7 CCF projects, and we would also offer more assistance to needy students and also for disabled persons, and also we have also offered more CCF programs on needy families. So obviously, in terms of our strategy, we try to specifically highlight some of the groups that we would be helping, And then on a poverty line, as I said, that would form the basis for poverty alleviation, and there are three functions. Number one, we try to understand the poverty situation, and that would also assist the administration in formulating policy so that we would also be able to assess the effectiveness of our policy. And also with regard to government's poverty alleviation work, that would also play a very important part. So that would form the two, and also by poverty analysis, we would also be able to identify the needy groups. For example, in the 2014 policy address, we have already formulated this blueprint. So we have identified the groups to assist, for example, the LIVA, that would also target the needy groups. So that, as shown in the PowerPoint, we're trying to help them. And also, we would also be able to monitor if the policies have been effective in alleviating poverty.
The basic concept is relative poverty. Now, we take the monthly median household income before tax and transfers. We take the 50% line, and that is the poverty line. Now, this is according to international comparability principle, and we follow this OECD guideline practice, and the SOCO and Oxfam, they have always championed this poverty line, so this is widely acceptable and understood. And yet there are limitations with the poverty line. Firstly, it's relative poverty, so statistically there will always be poor people. The line, there will always be people beneath the line. And also, we take into income, but not assets or liabilities. So if you are low income and high ability, you would still be classified as poor. This is not very desirable, but because we wish to make things simple and make it easily comparable, we adopt this criterion. So there are these people with low income but high high assets. Now, this is not a poverty alleviation line. This is not directly linked to the CSSA or other assistance schemes. And also, there are several factors affecting poverty in 2013. Firstly, the labor market continued to improve. There has been new records in new jobs created and total employment, and the unemployment rate is low, and there has been real increases in grassroots wages. In May 2013, the statutory minimum wage was raised from $28 to $30. And so this has raised the income of working families. And also there's the old age living allowance. It benefits 420,000 elderly that's implemented. And then there are subsidy schemes such as the transport allowance scheme being enhanced, and so on. Now, the poverty line threshold increased in 2013 in absolute terms, and you can see that in the table. Now the line, if you are 2 to 6 person households, the poverty line has increased by about 6.8%, and for 1 person households, it's fallen a little bit because nearly half of them are not engaged in economic activities, so they do not benefit from the increase in wages and statutory minimum wage and transport cost allowance. Now also, poverty line can fall now in January 2003 because of SARS and Asian financial crisis. There were two points where the poverty line fell. what has happened? Is it fire alarm? Is it a fire alarm that took place in the afternoon? I think we can continue. I was saying that for 2 to 6 person households, there was an upward trend, and the next chart. Now, there are two parts. Now, first is the regular transfers as a means of intervention, now CSSA, etc. And second, non-recurrent cash intervention that includes poverty alleviation measures under the budget that are one-off in nature, and also non-cash subsidy, mainly that's the public housing. So that is a form of assistance that's on a non-cash basis. And before policy intervention in 2013, the poverty rate was 19.9%. Now there was an increase in the poor population because of relative poverty. The wage rose, so the threshold increased. So those who some people who stayed below the poverty line, and also retired elderly increase in number due to population aging. Also we because of now there has been improvement in after policy intervention. Now the blue line shows that there has been a fall by 171,000. So the poor population has fallen from 1.33 million to 970,000, and the poverty rate dropped from 19.9% to 14.5%. So after the regular policy intervention, the poverty rate fell by 5.4%, and the poor households, the poor population, etc., all fell. Now, on non-regular cash policy measures, if that intervention is included, the poverty rate fell by 1.9% to 12.6%. That's in the dotted line. Now, on non-cash benefits, that's $23.2 billion, and also there's no means test, so but you see the alleviation effect. Now, as for non-cash benefits, that includes the public housing benefits, then there's further improvement. You can see that the last line, the red dotted line, it fell by 4.7%. That is, it fell to 9.8%. So an additional 15,000 households were lifted off poverty. So it's very important to increase the public housing availability. That plays a very important role in alleviating poverty. I will not go over the three parameters: number of poor households, the poor population, and the poverty rate. Now let's come to the next PowerPoint. We will analyze the population and make some observations. Now, this is at three levels. So we first look at those children under 18, and secondly the adults, and then the elderly. Now, if you look at the poverty on the left, that's before intervention, and on the right is after intervention. You can see the clear difference. Now, before intervention for the children, those under 18, for the poor population and the poor households, there's 189,000 and 18.6%. Now that there's a drop of 19,000 children and a drop of 1.3%. But this poverty rate is still higher than that of for the population as a whole. Now for adults, now because we have two-track scheme for the transport cost subsidy, now the poverty rate has fallen from 10.8% to 10.5%. Now for the elderly, it's not that obvious now because of OALA. You see the effect. So the poverty rate dropped from 33.3% to 30.5%. So that's a drop of 2.5%. So 11,000 households were able to benefit from the OALA, and over 80% of the elderly poor benefit from different kinds of social security. So the small number left have not benefited from social security, but we have analyzed and we know that 40% of them live in public housing, and for those who do not receive social security, most of them do not have financial needs, and 40% live in private housing without mortgage. So that's because we didn't ask about the assets. 30% of people, of the elderly, are poor in Hong Kong, but actually that's hasn't taken into account the assets that they might own. Now, on the how the poverty, how the poor people are targeted. Now, for those who get means test under CSSA, the poverty alleviation rate has been more conspicuous because the aid is targeted. So $13.5 billion CSSA, and the poverty rate has dropped by 2.8%, and OALA dropped by 1.6%. Now, and for the other kinds of allowances, the percent is lower. Now, if you further break down by the households, now 384 out of the 970,000, now about 300,000 households did not receive CSSA, 760,000 of them, and on the right-hand side, 84,000 households, that's they receive a CSSA, about 200,000 of them, and then the final column, over 10,000, these working. These show the those who are not working or unemployed, employed, or not in economic activity. Now, there are 300 non-CSSA poor. Now, then you see the breakdown, and 64% of are the recipients of OALA. And of the unemployed, 380,000 of them, 70% are unemployed on a short-term basis for less than half a year. And now the labor market is quite tight. Now, if they do have the motive, they won't have too much difficulty getting a job. Now, on the non-CSSA working poor, now, in 2014, as I mentioned earlier, we analyzed and we dealt with in a targeted manner the working poor families, low-income working families, and now 700,000 will benefit, and 40,000 people will come off poverty, and the poverty rate will fall by 2.1%. Now, if we introduce the LIFA, we can reduce the poverty rate to 12.4%, and the children's poverty rate will also fall by some 4%. That's quite a large percentage.
And if you look at that by way of the districts that they are in, then from this chart you can see it very clearly. Sorry, Secretary, can you go faster? Alright, Kwun Tong, Yuen Long, Sham Shui Po, and Wong Tai Sin. These are districts where we have to pay more attention to. And then finally, for poverty alleviation work, we have now seen some initial result, but then we cannot afford to be complacent because a lot more needs to be done. And then for the poor population, that has come down from 1.04 to some 972,000. And at the time, in 2009, that was some 15%, and now that's a 15-year low. So that's something that we need to pay attention to. And then if you look at this slide, well, when our welfare has come in, when there are more resources for welfare, you can see the overall situation improve. In 2013, well, at the time, the spending, welfare spending involved some $18 billion, and that would account for some 12 to 13%. But then, since then, we have substantially increased welfare spending. And last year, in 13-14, we are talking about some 51.8%, accounting for some 18.1%. And then this year, it has gone up further to $56.9 billion, accounting for 18.5%. So, in other words, $1 in $5 would be spent on that. So a lot more has been spent on healthcare. So you can see that we are devoting a lot more attention to welfare and healthcare. And finally, the current policy of the administration in alleviating poverty is to encourage employment, and we would also be caring for children. That's also the axis of our policy, and the COP would also be mainly providing the platform for poverty alleviation, and we will look into different policies, in particular those special groups in need of help, and we would also try to identify the groups and clusters of people, in particular those with disabilities and also ethnic minorities, and we would like to we would like to understand the needs of these groups in order to provide for data for the administration in formulating policy, and the CCF would also be able to plug the loopholes and fill in the gaps, and would like to seek the approval from this council for the LIVA, so that we'll be able to launch it in 2016. And once again, for the poverty line is a threshold, and with an aging population and with also an increase in the wages, there are bound to be some people who are living below the poverty line, and there is also room, and there is also a limited room for the further lowering of the poor population. So that said, I'll be more than happy to exchange views with you. All right, we have Tan Kap Hill, Fernando Cheung, Leung Kwok Hong, KK Kwok, and myself. Tan Kap Hill, thank you. How many minutes do I have? 4 minutes again. Chairman and Bureau Director, all right, with the introduction of the poverty line, and there is a reduction in the poor population. I think we are all glad to see that. And of course, much has to do with LIVA, But then even if the filibustering members are willing to give up on the filibustering, that would still take some 15 to 18 months before it can be launched. All right, before Christmas, if we are able to approve LIVA, then when will it be available for people to apply, and when can they get the money? And what if we can only pass it in January? That's the first question. And just now, as you said, there is a group of people whose assets might not have been looked at, and that's why you might have overstated the poverty situation. But then in terms of actual spending, have you looked at that? All right, if I go to Cafe de Coral, all right, if I just order a dish of rice, that would cost me some $30 and something. And then in Mongkok, well, for a lunch set, that would cost them some $40. So the spending is quite high. So have you conducted a household expenditure survey? So have you conducted this survey in order to provide you with a baseline? So even if nominal wages have gone up, but then in terms of the actual spending by the average household, it has also gone up. So have you looked at the situation? All right, you have the tools available within your control. All right, other than Dr. Law, who is helping you. Well, the Labor Department is also offering this working or the traveling incentive scheme. So there are still some $300 million available. So can you expand the scope of assistance? Because what we're most concerned about would be the working poor. And also, even if you're able to increase the amount of subsidy, then that would help lift them. That would go a long way in helping them to get out of poverty. So during the past 3 years, you've only spent about $1 billion on that. For every $100, you've only spent some $20 on administrative costs. And if you're able to substantially increase that, then that would also help lower the portion of administrative costs. Would you be prepared to do that? Because the working class will be happy about this. Because if I'm eligible for LIVA, then actually that would also have to do with the households under the WIFA. So that's the work incentive allowance. So would you be prepared to do both? Well, if the FC is able to approve that before Christmas, then that would also be my earnest hope, because everybody would then be able to have a very happy Christmas. But then I doubt it, because there are many items in the queue. I hope that we can have some good news after Christmas, because you are going to have the last FC meeting before Christmas this Friday, and I hope that, and I understand that there are many items that will have to be processed by the FC. But then whether you're able to approve that next month or so, from that month onwards, it will take about 15 to 18 months for us to process the scheme, and then we can roll that out in 15 to 18 months, and the longest will be 18 months. And if we are able to do it faster, then we'll be able to do it in 15 months. So let's assume that we can approve it in January. Then in the second quarter of 2016, we'll be able to roll that out. So we will try to work full steam, and we will not waste time, because we understand that you've been looking forward to this for a long time. And then on the expenditure of the average households, have we looked into that? In fact, we have already given an account to the COP. And mainly, we will be looking at the income, because that would be relatively simple. Because for expenditure, yes, the Census and Statistics Department will be conducting that survey once every 5 years. But then on income, well, some of the data could be updated every year. That's why you can see the change in the groups and also the population of that group and so on. For the expenditure, if you can only do it once every 5 years, we will not be able to update the figures, and the policy would be even more rigid, because you're not able to reflect the reality. But then we have Professor Chow Ki-li, who has done this survey. It's very interesting. Well, I think the third point is related for the WITS, whether or not that can be used to fill in the gap during the window period to ease the pressure. Well, Mr. Tang, you've raised this before, and you've also provided us with the information. In fact, the Labor Department is now reviewing the WITS. Well, for the $600 in 2007, well, by now, traveling expenses have gone up by some 30%. That's why you will have to review it. Yes, that's why we have to look into it. Yes, Fernando Zhang. Thank you, Chairman. Number one, on the poverty line, you said that statistically there are bound to be poor population in any community. I think that's wrong. Given the fact that you have statisticians available, you should have looked into it. The first time when you announced it, we have already made it clear. In setting the poverty line, it's set at the median income level. It's not an average figure. That's why you will have to clarify it statistically. All right, you are in the SAR government. You should not be confusing the concepts in terms of statistics. Using the median monthly household income to determine the poverty line is not scientific. And also for elders. Indeed, after some social welfare transfer, there might have been some improvements. But then let's not forget that there are still some 30% of the elders living in poverty, and after the social transfers, some 30% of the elders are still living in poverty. This is not something that we should be pleased about. It's still on the high side. That's why for the universal retirement system or universal retirement protection system, it cannot afford to wait any further. And also, if you look at the overall poverty situation, I think it has likely gone up. Before the social transfer, we are actually talking about close to 20% of the population living in poverty. So 1 in every 5 families is living in poverty. That's not something that we should be proud of. Next, on CSSA, we have also noticed that there are still about 85,000 households living in poverty. They are already on CSSA and still they are living in poverty. That also shows the problem of the CSSA system. And what I'd like you to provide us with is for the 85,000 households who are CSSA recipients and they are still living in poverty. So what type of CSSA recipients are they? And also what's the size of the households? So can you give us more details? That would also show the shortfall of the CSSA system. And in your analysis, yes, in terms of the age profile and also the grouping and so on, you have done some analysis, but then you have not really looked at the poverty rate for those with disabilities and also the ethnic minority groups and also the women living in poverty. I hope that the COP would also be looking at these 3 groups so that we can have more detailed breakdowns on these 3 groups, those with disabilities, the ethnic minority groups, and also women in poverty. Bureau Director, on people living below the poverty line just now, the way we put it was that as the poverty line would fluctuate in line with wage fluctuation, that's why there are bound to be people living below the poverty line. That's a fact. So please do not distort that. We have to be pragmatic, because once the line moves up, there are bound to be people. There are bound to be people living below that line. Well, I'll try to give you a lecture on that. Well, for the median monthly household income, that's very different from the poverty line. Let's not argue about this. I've already put forth my viewpoint and you will have to go back and think about it. And you said that some 30% of the elders are still living in poverty. That's something that we are concerned about. So even if it's lowered to 30.5%, it's still on the high side. But then we do have this constraint because we have people with a lot of assets without much income. That's why for elders with very low income, they would be considered to be living below the poverty line. As we have already said, well, when we ask some of them, there are a group of people who are not on CSSA, who are not getting anything at all. Most of them would say that they do not have financial need because they do not have any mortgage payments to make, and they have their own flats, and therefore they do not need any assistance at all. But then it doesn't mean that we do not attach importance to that problem. That's why we have the WITS and also the OALA. We'd like to ease the pressure on the elders in need. And thirdly, you said that for some 80,000 households on CSSA, they are still living in poverty because we are not adopting an abject poverty line. We're talking about relative poverty. So we try to look at their needs and see how we can help them. That's why, inevitably, there will still be people living below the poverty line. And you also talk about the characteristics. Well, we will have to conduct some case analysis. We haven't done that yet. So I'll go back to see what we can do, and then I'll provide the information to you later. Ms. Ng might have some information. She might be able to provide that to members. Yes, please be brief. Indeed, in the 2013 report on the poverty situation in Hong Kong, we have looked at different groups of households. There is a general picture. In fact, in the report, we have talk about the basic economic characteristics in terms of the household size, and also the economic activities that they've engaged in, and also what kind of people they are. So we do have this general picture, and also in the enclosure that would also provide the details. If Dr. Fernando Cheung is of the view that the information in the report is not detailed enough, he can also tell us. And if he wants to get further information on a particular aspect, he could also let us know. Fernando Cheung, you will have to wait for the second round. I'd like to respond to this on people with disabilities. According to our analysis, well, in fact, the CNS department has done a study, and I think we should be able to share that information with you shortly. It's about the people with disabilities living in poverty. We have done an analysis. I think we should be able to announce that shortly. Mr. Leung Kwok Hong. Thank you, Chairman. Well, on poverty alleviation, one of the key areas is to encourage those who are young enough to continue to work, so that your policy is to help those who are not able to help themselves, and that would also help make the policy more sustainable. What about the elders? You said that we will offer them this OALA. So what is the implementation details about this scheme? How effective has it been? How many people have benefited? And also on the universal retirement protection scheme, I will continue to fight for that. So what progress has been made on the universal retirement protection scheme, and also what's the situation like with regard to the implementation of OALA?
On OALA, now we have received very good reception. 422 elderly people receive OALA, and it's $2,200 odd per month. And this will be adjusted upward to $105 once the FC approves this adjustment, and we will apply to the FC soon. Now, $2,285 plus $105, that's a 4.7% increase. Now, that will be effective 1st of February if the FC approves it. Now, as I explained, now the OALA is it helps the poverty rate 33.3% fell by 2.8% as a result of the OALA. Now on retirement protection, if you might remember, Dr. Nelson Chow and his team compiled a report at the invitation of this subcommittee, and we gave an account on that report. And the COP recently held a second meeting to further discuss this, and we think that there should be a consultation. But on the framework of the consultation and the contents, we'll wait for the second meeting. We think that a consultation is necessary. Now, the government really is open-minded. We think retirement protection is a very complex issue. We must be very careful in dealing with the problem and listen to people's views. So the subcommittee needs more time to discuss this. Now, you say the OALA has been effective. The 33% dropped to 30.5%. Now, well, if you have universal retirement protection, how much would the poverty rate fall? We haven't come up with that because there are many assumptions not yet available. Because if we use the OLA figures, we consider many factors, but there are different proposals regarding retirement protection. So we don't know, as in the case of OLA, where we do know the method. Now, if you just distribute $3,000, now there's a difference with the amount from the amount of OLA. You have to explain to the Hong Kong people. Now, people might be able to pay more to reduce the poverty rate. Do you have the figure? Chairman, we don't have the figure on hand, but when we do the consultation, we would certainly provide information. Now, on the arrangement, that would be discussed in the meeting. Please ask them to provide a document. When you issue the consultation document will have that figure. It should. Dr. Kwokaki, now the government is congratulating itself that the poverty rate has fallen as a result of the OALA, etc. But there are still 290,000 who are over 60 and 180,000 children who are still below the poverty line. And so those who are under 60, over 64, and those are under 18, they are the most marginalized in our society. In the education, etc., are affected. Now, not long ago, we have the Subcommittee on Special Education, and we dealt with these issues about the poor families. The government tells them to go to the voluntary organizations. Now, the session of help cost between $500 to $800. Now, even if they get LIFA, they will still be poor. Now, we're not talking about just the basic needs for living. Now, many of them are still queuing up for public housing. You can see that the waiting list for the public housing is reducing at a snail's pace. Now, C.Y. Leung will leave office in 2017. But a lot of people will still be on the waiting list. Now 1 out of 7 children have 7 special educational needs. Now they are sitting at home. Now they suffer from poverty and lack of assistance and no resource to improve their plight. I'd like to ask the Secretary, can you tell us that you have already completed your mission and you will give up on them because your policies don't help them? These poor families with children. Now, that the LIFA doesn't provide for these special educational need sessions. Dr. Kwok is saying that even if we have low-income working family allowance, there may be these families with special educational needs, not handicapped, special educational needs, the hyperactive, etc. So, okay, let's for say LIFA, 4-person family, $15,400 and $450,000 in assets, and the father has to work a minimum of 144 hours. And then if they meet these thresholds, they can get $2,200 in subsidy in LIFA, and the session costs $800. Now, of course, if you go and talk to psychologists and psychiatrists, each session costs hundreds of dollars. And some preschool children, there is a subsidy scheme right now. The queuing time right now is rather long, 12 to 18 months, and we have a temporary scheme so that when they are queuing for the government scheme, they can purchase the service in the private sector. So it's a subsidy in effect. So the window of opportunity will not be lost for these children. Now, it used to be a pilot scheme, and now we've regularized it. We have funding for these families to alleviate the pressure while they wait on the government list. So we do have ways to help these needy families. Of course, I understand. Maybe you can wait till the second round. Chen Yunhan? Now, I want to make sure of one thing. This government, regarding the poverty line, measures in the Commission on Poverty, for instance, the OALA, those have been positive. And you hope to pass the LIFA this year. Now, these measures, well, you can see the situation regarding the poverty line. And you can, so I think OALA, etc. are good. But does this mean that all of Hong Kong's problems are resolved? Of course, it's difficult. Well, I think Hong Kong is better equipped than other cities to do better. So I will say to the Secretary, you must be flexible in your stance. Now, you say that many of the elderly are in fact not poor. They have lots of assets. And then you say, in fact, that these people don't really collect the OALA. I think the government has to look at the problem in a comprehensive way. If you adopt an appropriate stance, you are not really dealing with the problem. Now, on the working poor, you say that you can solve the problem by OALA. Well, of course, the OALA would help these people. But I'd like to tell the chairman, whether it's the OALA or LIFA, LIFA, you have income threshold. For those who fall off the threshold, how about help for them? Say, for those 60 to 65, how is the situation regarding subsidies for these people? Now we have a comprehensive social security scheme. Very often the assistance is inadequate. Those who want to receive CSSA must get their children to sign a statement saying that they do not support their parents. So these are problems that we like you to answer. You have to adopt a better stance and not be complacent. Now on the working poor, now you cannot attribute everything to the lack of LIFA. Now, I hear a colleague asking about women's poverty. There are 400,000 odd females who want to work. Now, you should help them. Now, many of them don't want to merely collect assistance. So, are there enough? Is there enough time? Now, certainly we won't be complacent regarding the OALA, but it does have alleviating effect. 120,000 elderly people will receive an additional $105 in the near future. And we are not saying that the problem is not serious because many of these elderly have a lot of assets. But the fact is that we don't know how much assets they have. And the Census and Statistics Department do tell us that many of the elderly don't have any financial needs because they have their own, they own their own housing and they're without mortgage. So there is some exaggeration in the poverty rate. So the poverty rate for the elderly is below 33%. And
on the OALA, would there be any age limit? No. So long as you're working, so long as you are trying to be self-reliant, so long as you're working, you will be eligible. But then with regard to the setting of wages, I think there is this constraint. It's about the working hours. But then that's very lax too. So on women in poverty, in fact, the OALA or the LIVA, all right, if they've been working 30 hours a week, then they would still be offered this LIVA. Well, Bureau Director, you will have to wait for the next round. On the people who try to tag to their children on CSSA, in fact, the High Court has already ruled that is unconstitutional. That's why many of those who were not eligible would now be eligible. I'd like to point out that for CSSA recipients, many of them are already living in hardship. And since the 90s, we've been talking about whether CSSA is adequate in providing for food, and now there are adults who have to live on the children's CSSA payments and so on. So we are trying to bring out the problems that we have seen for you to consider, including women in poverty. How do you help them to get employment? So I would line up again. Next, Leung Chi-Cheong. Chairman, I remember that during the first term of the COP, it was proposed that there should be a strategy on a district-based poverty alleviation, and then during the second term, the COP came up with this idea of a poverty line, and then with the setting of the poverty line, you try to distinguish who are living above or below the poverty line, and you try to adopt a more targeted approach in helping them. But then when I see this, well, if this is your strategy, of course it will be effective. In particular, during the second term, with the poverty line, you have a yardstick to measure whether people are living in poverty. And therefore, you will be able to target your policy to help ease the pressure. And then the Chief Secretary recently said that you have already done your best, and there is a limit as to how far you can do to reduce the poor population. All right, after the poverty line has been drawn, when you look at a policy intervention, well, post-policy intervention in some districts, the situation has changed substantially. Well, let me cite an example. In Kwun Tong, if I'm correct, well, in fact, most people who are in poverty would be the elders, and therefore, post-policy intervention, the size of the population dropped from 160,000 to some 30,000. So you've managed to salvage many who used to live in poverty. And then in Yuen Long, well, in principle, it's a young community, and it's been reduced from about 100,000 to 80,000. So if you look at the ratio, it might not have dropped as significantly as that in Kwun Tong, because after the OALA has been introduced, much of the poverty problem would have been resolved. It's relatively easy. But then in Yuen Long, the situation is not like this. Relatively speaking, when compared to Yuen Long, the rate of drop was less significant than that in Kwun Tong. That's because we have more single-parent families and also low-income families in Yuen Long. Well, thinking back, if you have adopted a district-based approach during the first term, then it would be more appropriate during this time, because the policy would be looking at the income of the population, and then you would try to make some strategic adjustments, and as a result, you would have more policy intervention, and on the whole, there would be more relief. But then at this time, you will have to go a bit further. And if you want to resolve that problem more comprehensively, you will have to look at the characteristics in a particular district. I agree with what you said, Bureau Director, in a sense that you will have to make the families more self-reliant so that their income can go up, and then they will be able to resolve their own poverty problem. But then at the same time, if you do not have any strategy, then it's not going to help. For example, if you just offer some assistance to the children, I'm referring to the assistance or subsidy to the working poor families. Well, that might work, but then still, we are talking about the community's aspiration. In particular, there are some job types that they are in the low-income group, and you are the secretary for labor and welfare, and therefore in this regard, how are you able to resolve that problem? In particular, for people living in Tin Shui Wai, if you do not come to the urban area to work, then you will not get high wages. You will only be earning some several $1,000s a month. So how are you able to resolve that problem? Well, let me clarify. In Yuen Long, with regard to the to OALA, in fact, the result has been most effective. That has come down from 38.3, and that came down by more than 5% in a year. And then in Wong Tai Sin, the same happens. So for the elders, they have been greatly relieved, and there was a reduction by some 5.6 percentage points. So that's very obvious. And you were right in pointing out that, well, for LIFA, we are looking forward to that, because once it's out, then in Yuen Long the situation would be much improved, because we have many single-parent families and also new arrivals, so long as they are able to work. All right, if you're able to cross the boundary from Lowood, then you'll be able to get it. So there is no restriction at all. So long as you're working, and if you have children in a family, then you'll be eligible. So that really will help the new arrival families. And then during the new term of the COP, we did not have enough time to discuss that, and at the next meeting, we'll be discussing our strategy. So should it be more district-based? Well, after all the macroscopic measures, should we be looking at the district-based situation? Should it be more microscopic? So we can explore that later. Absolutely, I agree that we should have an open mind on this. We should adopt a multi-pronged approach, so that as long as we can help people get a job, then we will be prepared to do it, so we can help people to lift themselves out of poverty. Yes? Mr. Lee Chuk-yen, I think the whole issue of poverty, well, next time we'll be discussing that. We'll be discussing women in poverty and whether they can get jobs. Well, as the Secretary for Labor and Welfare, you're responsible for both welfare and labor. And on welfare, you can help them by providing more childcare services. But then, after the policy has been introduced, you'd like to promote women. You'd like to promote women in employment. I think the most important thing is to offer more childcare services to them. And we've been talking about several things, and we haven't got the answers yet. One, well, for the community nanny, it should not be so outrageous. You're actually creating poverty, because for the community nanny, they will only be getting $20 an hour. So you have not been changing that at all. And then for community or neighborhood childcare services, well, for the district-based places, that's not adequate. And also for those infants are below 2, and then 2 to 6 is toddlers, and then they will have to go to kindergartens for half day. But what about the other half day? And then by the time when they go into primary schools, they'll be at school until 3 p.m. Then what happens next? Nobody will be taking care of them. So at primary schools, can there be childcare services after school? So those would be after school care. You have some pilot programs now. Why can't that be extended to all the districts, so that after 3 p.m. the schools can be open to primary school students, so that they can stay in school to do their homework? And then there can also be games and after-school activities. And then by the time when they get home, they do not have to do their homework. If you're not willing to do that, then how can you unleash the workforce, the women workforce into the community? And that would not help boost women in employment. And you then talk about labor shortage. In fact, we do have a lot of workers available. We do have a lot of potential workforce in the sense of women who are not working now. So we have not heard from the Bureau Director in terms of community nanny and also childcare service and also after-school care. What commitment has the administration got in improving the situation? So nothing has been done so far. Thank you, Mr. Lee, for your question. The core of the issue will be dealt with by the Population Steering Committee, and there has been a very thorough discussion and consideration. We do have some view. I agree with what you said. That is the most important thing, is to unleash the labor force. It's not just about women. It's also about those with disabilities and also ethnic minorities and also the early retirees and also new arrivals. There must be support measures, and they would also have to engage in supported employment in some cases. So we will be working on that. Precisely, we are exploring different options. We hope that in the near future, we'll be able to share our thoughts with you so we can help unleash the women workforce into the community. It's not just about women. It's about the ethnic minority groups, the South Asians, and so on. So they will be able to join the workforce, and also for people with disabilities. Yes, you have given us a lot of suggestions, and many of them are very neutral comments and very constructive. What about the population policy? Honestly, you've been working on that for more than a year, as far as my recollection serves me. And up till now, you haven't got any support measures in place. So for how much longer do we have to wait? For how much longer are you going to sit back and do nothing? Well, in early next year, we're going to give you a comprehensive account. All right, it's my turn now. My own view is that for the COP, they've introduced this poverty line. That's an improvement. But then on the definition of the poverty line, I think it's a regressive step, because you only look at the income of the households. And as the Bureau Director said, for people's assets, that would not be counted. And what's the problem? Well, according to the COP, elders would constitute a major group of people living in poverty. So during the past 10 years and the next 10 years and then 20 years down the road and so on, there are more elders. And what I can see is that there will be more people from the middle class with assets, and the number will grow. And if they are retirees, they do not have any income at all. They might have savings, they might have taken out insurance policy, and still you would treat them as elders in poverty. But in reality, they are not poor people. So if you just have a poverty line that would only take into account the income of the people concerned, then that would not help the COP in formulating policy to target those poor population. And if you just draw up this line, that will also give rise to another problem. Well, as a member of the COP, I can see that there are many discussions, and still you have not been able to draw any conclusion. All right, public rental housing would be a means to help the poor people. But then still, you cannot treat public rental housing as a monetary policy to help them. All right, if you just look at monetary payouts, if you just work around that, then even if they are able to afford private housing, when compared to those living in public rental housing, they are actually living in poorer condition than their counterparts in public rental housing. So that would give rise to a situation whereby on the face of it, on the surface, they might be better off than their counterparts in public rental housing, but in reality they are poor, they are worse off. And also if you just calculate that on monetary terms, and if you want to improve the situation, then cash handouts would be the easiest way out. So whether they are elders in the form of OALA or LIVA, you're just talking about cash handouts. Well, at the COP, most members have been saying that you should not be giving cash handouts. You should try to do something to help them. So in the end, we just say that well, we need to have universal retirement protection, but that at the COP, most of the time we've been asked to think about ways that do not involve cash handouts. But then it's easier to give cash handouts. You're actually encouraging people to give cash handouts to deal with this problem of poverty. That's because of this definition. That's why that has given rise to the three contradictions that I just referred to.
No, there are other ways. Now, for instance, we create new job opportunities, new job categories. So, apart from paying them money, you have to help them get a job and make money themselves. Now, seems that members haven't been discussing this. Now, next time we will talk about community economy, bazaars, etc. That's one thing we haven't discussed very much. Now, this year in January we discussed the bazaars, but the FEHD, LCSD, they couldn't handle this issue of bazaars. Now, Vice Chairman, you perhaps can some officials can come and discuss with us. You can see that in Japan they revitalize whole streets in creating many job opportunities. And in Taiwan, they revitalized a temple and revitalized the whole community in the process. And all these are ways other than giving cash. So, Mr. Secretary, you should invite other officials to discuss this next time. Thank you, Chairman. No response. So we come into the second round. There are 5 members. We have to end at past. So we have to leave about 5 minutes to discuss administrative matters. 2 minutes each, including question and answer. Leung Kwok Hong, Tan Kah Kee, Chen Yun Han, Leung Chi Cheung, Lee Cheuk Yan. 2 minutes, including answer. Now, the poverty line concept is for measuring poverty. Now, this is a trick by C.Y. Leung. He takes income as the only standard. So if you give him money, then after a while he is out of poverty. But we know that the standard of living for poor people is different from that of elderly people. If you make money, but if you don't have public rental housing, then your living standard falls. So, apart from using absolute income as a criterion, you must study the income after relevant expenses. For instance, you earn $7,000, your subdivided flat costs, unit costs $4,000, then he is poor. Now, if you don't do that, the lifer is family-based. How about the people without families? So you're not really resolving the poverty issue, because he cannot benefit from lifer. He doesn't have a family, so how do you help them? Secretary? Now, let me reiterate. Now, on income, there are 2 grounds. Firstly, we follow the principle of international comparability. We follow the OECD mode. but rentals in Hong Kong are highest in the world. We understand that. That's why we say we are in agreement with Soko and Oxfam on poverty line, but the line has limitations. We don't see the assets. Now you frequently quote the Oxfam and but our party thinks differently. Now, now nearly half of them do not engage in economic activity. So LIFA, for those with certain number of for certain number of work hours only. So those without economic activity are not helped. Now, for those children, those families with children, you link that to jobs. Now that's a kind of discrimination. Now many families, the parents have children with special needs, so they cannot go and work. So they cannot reach the threshold, and they become poorer as a result. So this is unfair. This is inhumane. They don't want money. The money doesn't help them. They want assistance. Now, whether it's the disadvantaged children with special education needs, or even those who say the mother doesn't have the capability to help the child grow, and she doesn't have the resources. There is no policy to help them. The distribution of cash doesn't help them. Now, your approach is of a low level. You take some money and you show some nice figures, but those families are not helped even if they get your money. Your preschool program doesn't help them. In primary school, in secondary school, these children still need counseling. So I am disappointed. The scheme doesn't help them. Sorry, no time for the Secretary to respond. Chen Yunhan, now actually I asked a few questions already. Now, I support the government's efforts to alleviate poverty, especially for the elderly and for working families. Now, however, those who are singletons, they should be able to work and show their worth. Now, so say single women, single mothers. Now you like these women or women who want to earn money to help their families. Now they need to have a venue for them to meet, but the housing authority doesn't heed the needs. Now, in territories, many women want to work locally. For instance, to look after children and elderly people in return for money. Now, these are the social community nannies that I am talking about. You should organize some NGOs to help these women who want to help out with their families' financial needs. But the government isn't willing to do that. Now, member also mentioned this. Why don't you help them? Sorry, no time for answer. Leung Chi-Cheung. Thank you, Chairman. Now, I'd like to ask, now, this report, who can get a copy of this report? Now, many members of DAB want to get a copy, but cannot lay their hands on one. Also, on the question raised by Tan Ka Piu, low-income families, why does it take 18 months for the LIFA to be implemented? Now, as in the case of OALA, as the matter was being discussed in LegCo, you were already working on the scheme. Now, I believe LegCo members will not stand in the way, even they want to put on a show of non-cooperation. So I think the government should do the preparation work in advance. The poor, working poor should not have to wait till mid-2016. Now, on the report, Mr. Leung, this is already on the internet. If you want a hard copy, you can talk to the Secretariat. We can send over some copies. Why does it take a minimum of 15 months for the LIFA to be implemented? Now, we have actually done the advanced work already. Some contracts have to be signed. Tendering has to be implemented, invitations for tender. Now there's a lot of computer work, a lot of manpower would be involved. Now we have already been devoting a lot of resources. In the case of OALA, you were able to save 2 or 3 months. But this scheme is more complex than OALA. There are 710,000 people, 200,000 households. Now, we know 15 odd months is long, but we will try to do better. Lee Cheuk-yan, the government has created the poverty issue, so it has to resolve it. Now, this government cannot say it alleviates the poor because it has created a poverty issue. One thing is the social community nannies, and then there's the outsourcing of contracts. Now, the minimum wage will be increased once every 2 years. The outsourced workers have to wait for minimum wage to be raised before they get an increase. But the government says if outsourcing by the government, there has to be one salary increase each year. Now, you should require that for the private sector too. Now, minimum wage only a review only every 2 years. Now, the last increase 1st of May last year. Now, we will have to wait till May next year for the next increase in SMW. So the government has created the poverty issue. I don't agree that the government has created poverty. The government wants to alleviate poverty. That's where our efforts are directed. Now, on community nannies, I responded to that before. The main purpose of the program is not to create jobs. It is to provide community support so that people can help each other. Now, the women in the community can look after their children as well as other people's children. So this is in the spirit of mutual help. Sorry, Ms. Chen Yuhan, no more time. We have Secretary. Now, overall, I think the spirit is not just to distribute cash. May I say one more sentence? Certainly, we do not just distribute cash only. The families must be empowered so that they are equipped to rely on themselves. So distributing cash is only one approach. But COP has to come up with these proposals. You must increase public housing. Do you have committees on how to create jobs? You don't. So please think about that. We thank you for attending. I have a simple question. Now, we don't have time for detailed discussion. Now, this subcommittee will come to the end of its term at the end of January. If we want the subcommittee to be continued, this has to be dealt with at the House Committee, and the Committee on Poverty is now in its second term. If you have no question on that, the Secretariat will write to the House Committee to apply for extension. So in February, we have to elect the new chairman. So on 12th January, we will have the last meeting in which I am chairman. We will talk about women in poverty and ways to enhance employment or opportunity of people in poverty, 4:30 that day.